All right, so now that you're getting Part B, you'll have two main coverage paths to choose from. The first one is Original Medicare, and the second one is Medicare Advantage. So we'll start with the Original Medicare first. It includes a Part A for hospital care. So that is what you got when you signed up for Part A. And then there's a Part B for doctor visits and outpatient services. This is what you get as soon as you sign up for Part B. With original Medicare, you'd still pay the standard Part B premium, which is $185 per month in 2025. And for most services, Medicare pays 80%, and then you pay the remaining 20%. You can also add a Part D prescription drug plan with original Medicare. And then you can also choose a Medigap plan to help with out-of-pocket costs like deductibles and coinsurance um, with those 20% that Medicare doesn't cover. Original Medicare does not include an out-of-pocket limit, so many people get a Medigap for financial protection. The big plus is that you can go to any doctor or hospital in the US that accepts Medicare. So no networks and no prior authorizations to see specialists either. And then when it comes to the timeline, you have two timelines to pay attention to. Uh, there's a 2 month to enroll in a Part D plan for prescription drugs, and then 6 months to apply for a Medigap plan with guaranteed acceptance. Though for uninterrupted coverage, applying right away is best. The second option is a Medicare Advantage plan, also called Part C. These are offered by private insurance companies and combine Part A, Part B, and usually have a Part D as well. Some plans include extra benefits like vision, dental, or hearing. You'd still pay the Part B premium, but the plan premiums can be really low or even $0. And Medicare Advantage plans use network providers, provider networks, either HMOs or PPOs. So basically, the Medicare Advantage plans generally require beneficiaries to receive most of their care from providers within their plan's network. These plans come with a built-in maximum out-of-pocket limit, which helps cap your yearly medical costs. And just like with Part D, you'll need to enroll within 2 months after your job coverage ends. So how do those two options sound to you so far?
I think I'm leaning toward Medicare Advantage. It feels more familiar, kind of like what I have now.
All right, yeah, definitely a common feeling, especially for people coming from employer plans. I can walk you through a few key questions to help you compare. Do you prefer the freedom to see any doctor nationwide, or are you okay using a network of providers?
I'm used to networks and I'm fine with them.
Got it. All right, so let me talk to you a little bit about the two types of Medicare Advantage plans then. So like I mentioned, there's an HMO plan, which tends to have lower monthly costs, but you still must stay in network for most care. You also need to get referrals to see specialists. Whereas with the PPO plans, you have a little bit more flexibility. So you can see out-of-network providers, though you might end up paying a little bit more, but you won't need referrals for specialists, and the premium and co-pays might be a little higher. Also, both types of Medicare Advantage plans require prior authorizations for certain services like physical therapy or outpatient procedures. When it comes to the cost limits, though, HMOs have one in-network maximum out-of-pocket limit, whereas the PPOs have two, one for in-network and the other one for combined in and out-of-network costs. So let's say your in-network maximum out-of-pocket is $6,000. If you only see in-network providers, that is your cap. But if you go out-of-network, then the combined limit might be $10,000. So you'd need to hit that total before your plan covers 100% of the cost for both. So one good question to consider is whether you spend any time out of state.
Yes, I usually go to Oregon for a couple of months each winter to see my daughter.
All right, so that helps. So A PPO plan might work better for you then, since it offers some out-of-network coverage while you're away. So if flexibility is your priority, original Medicare may be a good option because it lets you see any provider that accepts Medicare and does not have networks or referrals that will need to be required. Another aspect to consider is whether you want to keep your current primary care doctor or any specialist.
Yes, I would really prefer to stay with them.
All right, so in that case, I would also recommend calling their office to ask which Medicare Advantage plans they accept, and just to confirm whether they take original Medicare. This will help narrow down your options.
Okay, thank you. I will do that. Now that I think about it, I saw a commercial that mentioned a plan with a premium reduction. Something about a give back?
Oh, yes. Some Medicare Advantage plans offer a Part B premium giveback, which lowers the cost, which lowers the amount taken from your Social Security check. But a few things to keep in mind that givebacks might not be as substantial as you might think they are. The amount can vary widely. So some just a few dollars and some more than that. And then they're also not offered in every plan or area. So that's something to consider. And then they can change. It can change every year during the annual enrollment period. So while it's a nice benefit, it's always important to look at the overall plan value, like the network coverage and copays, not just the gift back itself.